Here we come to the discussion part. The discussion here, the implications of the research results are evaluated and interpreted in relation to the research question, explaining how the aims of the study have been met. This is very important. And discuss the results of this study and those of other studies. Here is the importance of having a good literature review in the very beginning, because basically at the very end you need to compare your results and discuss your results, the results of your research compared to the literature, compared to the work of others, whether it's similar, whether it's different, why could it be similar, and what could be the reasons if it's different. It shows the insight into the meaning and significance of the research findings. So in the results section, researchers do not discuss or try to interpret the number. They just put the numbers there and in a systematic manner. But the discussion is where the researchers tell us what do these numbers mean and how to interpret them. Any limitations of the study, including bias, should be clearly presented. At least there should be some mentioning of the limitation or the limitations of the study, including how bias, what could be the sources of bias in their study and how did they try to manage it. So the questions include, did the researcher highlight the most important results? Obviously, we do not expect the researchers to discuss each and every result that they have found given the word count limits. However, they should highlight the most important results. Does interpretation arise logically from the data, or is it too far-fetched? Again, sometimes some researchers go beyond what is mentioned in their results and make perhaps far-stretched conclusions. They overgeneralization or overestimation of the importance and significance of their work. So we have to be aware of that. Does the study consider key studies in the field? Again, this returns us to the literature review, what kind of literature they have referred to, because this is the kind of literature they are going to compare their results to. Have the results been used to support or refute the results of other studies? Again, this should be a matter of critical discussion of their work in comparison to the work of previous studies in the field. Have the strengths and all the faults, the flaws, the shortcomings and limitations of the research, including generalizability, been addressed? It's very important that the researchers are aware that there might be some flaws or some mistakes or some genuine errors or some limitations, and how they have addressed that. Is the interpretation supported by other research cited in the study? Again, it's very important to link between what they have mentioned early on and the result that they have found. Are there any conflicts of interest noted? And this is a requirement for any publication, that the researchers should disclose any conflicting interests, especially when it comes to a product. We need to make sure that there is no financial relationship between the company or the enterprise producing this equipment and the researchers, at least to be aware of that. Let's have a look at an example of discussion. This is a discussion from the antibiotic resistance and serotype distribution of invasive pneumococcal disease before and after introduction of pneumococcal conjugate vaccination in Saudi Arabia. Okay, this was published in Vaccine Journal in 2012. It might be hard to read it all, but these are the main highlights on how to critically read the discussion. For example, they have highlighted the important findings. They have the indicated little change in the resistance level over time, ranging from this percent penicillin resistance to that percent erythromycin resistance over that period of time. So this is one of the main findings. Then they have compared their work to the work of others. Okay, for example, they are comparing to, in this case, to Tawfiq and Shib. Here they are, anyone can buy antibiotics without prescription, etc., etc. So they are making kind of logical interpretation of their findings. They have also mentioned the limitations, because basically to explain why there could be differences between the different regions, they have included in their study. Then we come to the conclusions and the implications on practice, which is usually a short but again important part of the article that we are reviewing. This section should summarize the main points and indicate the usefulness of the research. It should not include any new information because basically you are concluding the study. Areas for future research may be suggested. Again, it depends on where to put it. It depends on the journal perhaps, or how the researchers would like to put it. They should be clearly stated and will only be valid if the study was reliable, valid, and used for representative sample size. So what kind of questions we need to ask to appraise conclusions and implications? Where the main points drawn out, it's very important to provide us a summary. It's usually 1 to 2 sentences summary or conclusion of the research that was done. Where fresh insights or a new perspective on the topic demonstrated, again, it is very important for the researchers to tell us what was the new thing, what was their addition to what is already known. Have any recommendations been made based on the research? Researchers should provide us with recommendations, not only the need for further research, because this is obvious, research will be going forever, but also if they have practical specific recommendations based on their findings. What relevance for practice does the investigator identify, if any? It's very important also to the investigators, the researchers tell us why their research is important for practice and how can it affect the practice or policy. Have the conclusions and or recommendations been appropriately drawn from the data analysis? And it reflects how how good the research is done, the article is written, because it flows in a consistent way. For this conclusion to come from the data analysis, from the results section, it's not something to conclude something that is not related to the kind of to the information or the data that they have gathered or the discussion that they have discussed. What generalizations are made, if any? It's very important for us to whom do these results apply? Are the generalizations within the scope of the findings or beyond the findings? As critical readers, to make sure that the conclusions are drawn from the results and do not go beyond them, and to avoid over-representation or over-generalization of the results. What recommendations for future research are stated or implied? So it's important that the researchers, whether here or in the discussion as we've previously mentioned, to tell us what could be areas for future research that they recommend. Are there other studies with similar findings? It could be useful to tell us in brief whether the findings of this study was similar or significantly different from other studies. What risk and benefit are involved for patients if the research finding would be used in practice? It's a couple of sentences to tell us why this research is important and how could affect the patients. Is direct application of the research findings feasible in terms of time, effort, money, and legal and ethical issues or considerations? That the researchers tell us about the applicability of the feasibility of the recommendation they make, and whether change in practice or policy is possible, and if possible they need to tell us how could that be possible given the efficiency that is expected to be. The authors should tell us more about how to apply this. If if they have specific recommendations for policy or for practice, they need to tell us more about how to apply this. Would it be possible to replicate this study in other clinical practical setting? This was part of our questions in the study design and the methods, which should have enough details for it to be replicated. It should be also part of the conclusion. Let's have a look at an example of a conclusion from the same article that we have just mentioned. In conclusion, it's short, it's one paragraph with roughly a couple of sentences to tell us about this. Although they may not include all the aspects or all the requirements that we have mentioned, and it could be written in a slightly different way. However, the conclusions are usually 1 to 2 paragraphs maximum, with at least highlighting the main issues that came out from the study. Now we come to the last part, which is how to critically appraise the reference list or the bibliography. The reference list or the bibliography should contain a list of all sources referred to in the article. In case of if it's a reference list, then it includes the sources that were directly referred to in the article. Or in the case of bibliography, the resources that helped the researchers, whether they have used them directly or not. What kind of question that we can ask? First, are all the sources cited clearly and with full bibliographic details? Again, I understand that this is now a requirement. We should not worry about that, but it's quite helpful to make sure that all the relevant information about each reference is clearly stated. Has a wide range of works in the feed has been referred to. Also, we need to make sure that the reference list is up to date, is related to the field, and it has good variety as well, i.e. the researchers are not biased towards a specific kind of literature. Does the list contain both similar or classical and more contemporary literature? Although we do encourage, as we mentioned at the very beginning of this course, to have recent studies, it might be helpful also to have some classical or old, in a way, references so that we can make a proper comparison about how things were used to be and how they are now. To establish the significance of research, there are some questions that can help us to tell whether this research that we have been critically appraising is good enough to establish its significance. So the question could be, did the research result in the formulation of new questions or hypotheses by the authors or other researchers? Again, this depends on the number of citations for this, how many times this article was cited, and how was it cited, and what was the reaction of other researchers to it. How did other researchers view the significance of the research reported by the authors? For example, how many times was it cited, and again, how was it read, and was it critiqued or praised, or how was it used in other studies? Have other researchers subsequently supported or refuted the observations and interpretations of these authors? And this takes us to the point that we need to read the articles which cited the article we are critiquing. It might seem like a snowball at one point of time, but I think it's very helpful exercise within its limits. Did the research produce any practical applications? In practical terms, what were the results used? Were the recommendations applied by the recommendations of that research applied somewhere, and whether this has led in any way to a change in the policy or the practice? Again, how do you evaluate the significance of your research? This could be your decision to tell. It might seem subjective, but I think if we have answered as many as possible of the previous questions, this would lead us to a point where we can comfortably tell whether this research is significant or not. In summary, these are my take-home messages. Critical appraisal is a great chance for you to improve as a critical reader, not just a passive receiver of the research or just trust whatever published. It doesn't work like that. You have to be a critical reader. It can be done for a variety of purposes, as we mentioned at the very beginning of this course. Make sure you follow the instructions for the specific task. In this particular course, it's about literature review, but if it's about, for example, a journal club, or it's for an assignment, or for evidence-based practice, you need to follow the proper instructions. Though it's not the main aim of this course, critical appraisal for evidence-based practice is an essential skill you need to learn, and I do advise you to attend the courses on evidence-based practice available on VMA. Critical appraisal only develops by practice, so start doing it with as many articles as you can. And as we mentioned from the very beginning of the course, it's preferably done with at least one of your colleagues. Applying it within a variety of domains, it is important to try it in different disciplines. Using the critical appraisal questions as a checklist for your own writing of research may increase your chance to have your work published and cited. It's again, although the purpose of this course is to provide you with the questions through which you can assess the research article that you are reading, whether it's good enough, significant enough to add to your list of literature or not. However, I believe that the same questions, if you put them in front of your work as you are writing, it will help you to make your publication as good as it could be, and hopefully published and cited. These are the references. I thank you very much for your time and patience. and hope to see you again in another course. Assalamu alaikum wa rahmatullahi wa barakatuh.